Good afternoon, everyone, and welcome to the final webinar of our 2019 Leading with Evidence series. Today, we will be getting a preview of 3 important fiscal considerations as states develop their prevention plans to meet funding requirements for Family First. I'm Suzanne Barnard, the Director of Evidence-Based Practice at the Annie E. Casey Foundation, and I will serve as your moderator for today's presentation. The Annie E. Casey Foundation, in partnership with the William T. Grant Foundation, is in our 4th year of co-sponsoring the Leading with Evidence series of convenings and webinars. As always, our overarching aim is to offer practitioners ideas that they can immediately apply to their programs and practices, and to help researchers gain more clarity on how to strengthen the utility of their work. Ultimately, it is our hope that all participants support the acceleration of the use of evidence, including research, to improve outcomes for the populations they intend to impact. Our presentation today will focus on developing a fiscal analysis process for putting prevention services in place that meet current evidence standards. You will hear from the developer and technical assistance provider of a new funding tool resource for calculating the fiscal impact of offering prevention services. You will also hear about how the state of Nebraska is putting this tool to use with help from collaborative partnerships from community-based and public-private stakeholders. Our speakers for this presentation are Margaret Flynn Kahn, who is Principal Partner with Mainspring Consulting and who you've heard from in the past other Leading with Evidence webinars. Allison Getkin, Assistant Vice President for Strengthening Families at the Nebraska Children and Families Foundation, and Jamie Kramer, Child and Family Services Administrator with the Nebraska Department of Health and Human Services. Before we get started, I want to take a moment to go over some important housekeeping details for the webinar. After we hear from our presenters, we will have some time for questions. We will keep our attendees on mute throughout the webinar. We ask that you submit your questions by entering them in the Q&A window, which you see circled on the slide. You'll find that window at the lower right-hand corner of your webinar screen, and you can submit a question there to panelists. If you are in full screen mode and want to ask a question, you may need to return to the event window by using the drop-down controls at the top of your screen. I should also mention that this presentation is being recorded, and the recording and slides will be available later at aecf.org. And now, let's get started with Margaret Flynn Kahn. Hi, Margaret.
Hi, Suzanne. Thank you. And good afternoon, everyone. It's great to be with you here today to share information on the work we've been doing to help states understand the fiscal implications of Family First. And Family First made really fundamental changes to 4E, the main federal funding stream that's historically funded foster care and administrative supports, as many of you know, I'm sure. And the important change that we'll be focused on this call is that it allows 4E to be used for prevention services. So you'll see on the next slide another key provision is the limits on federal payments for congregate care, but I just want to be clear that our tool and the focus of today's call is on understanding the fiscal implications of the prevention services. And part of the reason that this represented such a big change is that because 4E is an open-ended entitlement funding stream, it creates an opportunity to fund for states to better support families and fund prevention services in ways they haven't in the past. There's also a number of requirements in the law, and so it's complex to figure out how to best take advantage of the opportunity in a way that builds on what states already have in place. And so to help states address all of that complexity, Annie E. Casey supported Mainspring to develop a fiscal analysis tool that's aimed at helping states to do fiscal analysis of the prevention services piece of the law. The tool includes a narrative guide, so a guide that walks through what the key provisions of the law are, key considerations as you're moving forward, and a guide to a set of spreadsheets that really help states to structure a fiscal analysis. And right now we're in the process of piloting that guide. So we're piloting it with Nebraska, who you'll hear from, and Hawaii. And then we'll be making some revisions and making the guide publicly available in early 2020. For today, we have a handout that has many of the considerations and provisions of the law that are in our guide. So you have that as a handout. Those are linked at the end of the slides. We'll point you to those. And we also have a couple of handouts that are highlighting some of the provisions that are in some of the plans that states are submitting. And so as Suzanne mentioned, we focus in the tool, and we'll be focusing in the webinar today on 3 key elements of a fiscal analysis: costs, revenues, and savings. And so for each of these, I'm going to walk through relatively quickly. Again, you have a couple of handouts that have more of the detail, but we want to make sure we have time for Nebraska and for questions. And for each of these, costs, revenues, and savings, I'm going to review the key questions that you would want to ask in developing your plan and doing a fiscal analysis, key provisions of the law that kind of create the parameters for answering those questions, and then key considerations as you're moving forward with your work. So to jump into estimating costs, and I would say that this step of the 3 is the one where it's the biggest step and has the most planning, because, of course, in order to estimate costs, you have to know what you'll be implementing. And so the questions here begin with who will we serve? So who will our state define as at risk for entering foster care and eligible to be served with prevention services? What services and supports will we provide to them, and how long do we anticipate they would need those supports and services? And so the services include case management, evidence-based prevention models, which we'll talk more about the requirements of the law in relation to that, and then other types of supports and services that may not be an evidence-based model, but things like basic needs services that may be part of your current prevention services or that you want to include in your service array. And then in addition to those direct services, you want to think about what infrastructure is needed to support quality implementation and to comply with the requirements of the law. And so those are things, the administrative functions within your agency, things like planning and data and contracting, and some of that may be contracted as well in terms of training and fidelity monitoring and quality improvement types of activities. And then finally, once you've answered key questions around what are the core components we would include in our prevention plan in terms of who will be serving with what services, then you can move to and what would those services cost. And the law does provide provisions that help to kind of help you to answer these questions, or that really set the parameters around how you can answer them. So first, in terms of the question of who you'll serve, Family First says that it's candidates for foster care, those who are imminent risk of entering foster care, as well as their parents, kin caregivers, as long as the children aren't under the care and placement of the Child Welfare Agency, and then also pregnant and parenting youth in care. The law leaves it fairly open to states to define what that means to be a candidate for foster care. So that's one of the first really critical decisions that states need to make, and that will drive costs because it will drive the numbers of families that you're serving. And one handout that we've included in the handouts that are linked at the end of the presentation is a handout that reviews for states that have submitted their prevention plans already or that have them publicly available, that just lists out how states are defining candidates so far. So if you're a state who's newer in the process, looking at how other states have defined a candidate for foster care may be helpful. And then the other provision of the law that's important to understand is with what services. And so the law says that 4E can support prevention services, including mental health, substance abuse prevention and treatment, and then in-home parent education, parent training, and counseling. Guidance has clarified that those don't have to be delivered in the home, so it's that set of parent support and education services that many child welfare agencies are implementing. And these can be delivered to either children and youth or to families or to parents. In addition, the law requires that those mental health, substance abuse, and parent support services be evidence-based. I won't talk through this in detail. We've talked through it on previous webinars, but there's very specific evidence requirements in the law, and I would highlight in terms of the fiscal consideration that the law requires that 50% of state spending on prevention services be in the well-supported category. There is currently a bill, there's proposed legislation in Congress called the Family First Transition Support Act that would actually delay implementation of that 50% state spending requirement. That hasn't passed yet. If that did pass, this would change slightly, and states would be given more time before they would have to comply with the 50% of the state spending, but the law itself says 50%. So that Family First Transition Support Act is something to just watch for more guidance coming out from that. And then in order to help states to build prevention plans that meet the requirements in terms of evidence, the law also required that a clearinghouse be established that is responsible for reviewing the evidence on programs and classifying them in terms of these levels of evidence in the law. So that clearinghouse is up and running. They've begun their review of programs. You can see on this slide programs that have been reviewed and that have been found to meet the requirements, the evidence requirements, and what level those are. And then on the next slide, you can see programs that are currently under review, but it hasn't come out yet what level of evidence they meet, if they meet any of them. And the clearinghouse will continue to review and add programs on a rolling basis. So we would expect these lists, which are relatively short at this point, to expand significantly over time. And so right now there's a fairly narrow list of programs for states to consider when they're developing their plan. And on the next slide, there's been federal guidance because as this is getting up and running, there is a narrow list of programs so states, there's been guidance that's allowing states to include programs in their prevention plan that aren't on that 4E clearinghouse with some requirements that they submit an independent review of that program. So for states that have capacity in a program that they're confident meets the standards in the law, you can include that in your prevention plan. You have to include an independent review of that program that will then get reviewed by the feds, and they'll make a decision about whether it does in fact meet the standards and can be included in the clearinghouse. And we have the guidance on that linked as one of the resources at the back of the slide. So there is an opportunity to include programs that aren't on the clearinghouse yet. And so we've talked about key questions to ask and the key provisions of the law that help to set the stage for answering those questions. And what you see here is the data that we're typically kind of an overview of the key data that that's included in our tool and that we're looking at in states, both to help them to answer these questions, and then once they've answered these questions, to do the projections of how many families would be eligible for services, how long would they receive services. So this is some of the core data. I don't have time to go through it in detail, but it's historical data, a lot of it on who you've been serving in your prevention services array. It lists required in-home services. Many states are also including voluntary in-home services as part of their prevention planning. So there may be some additional categories that you would include depending on how your state decides to approach your definition of candidacy, but these can give you a starting point. And what we've generally been doing in planning is laying out requirements of the law, laying out what the current prevention service array is, and then looking at some of this data to get a handle on, well, how large of a population would we be serving if we were serving all of our mandatory in-home and our voluntary in-home, or adoption and guardianship disruption, to help inform a conversation about how that would be defined in the state. Some considerations around estimating costs. First, it's really important, so states will have to set rates for their prevention services that presumably many states will be contracting out. And really important to consider turnover because we know historically that there's high levels of turnover in child welfare. And for evidence-based programs, there can be, and there tends to be, fairly high startup costs in terms of training for new staff and curricula, things like that. So just making sure that you're building that in. We're building in as a starting point a 25% turnover rate, presuming that you would need to build in startup costs for new staff for 25%, but you could adjust that depending on what your local turnover rates are. And that you're really thinking about what it takes to implement in a quality way that will get you to outcomes. And then when you're considering costs for infrastructure and estimating costs, you want to think across what's needed within your agency. And part of this will be driven by, in your prevention plan, are you anticipating really scaling up certain services? Are you proposing to maintain what you have and pull in more federal support for it? So depending on the answers to those questions, you may need additional capacity within your agency for training and support, for implementation, guidance in teams, for fidelity monitoring, for contract management. So just being really thoughtful about those pieces. And one resource that I would point you to that's, again, linked at the end of the presentation is a couple of years ago, Annie E. Casey supported us in doing a paper where we really profiled child welfare systems who had focused on an evidence-based service array. And that really goes into some detail of the costs and resources at each point in the process, and a lot of that is about this infrastructure piece. So I would point people to that for more information. And then the next step, after you've considered and estimated costs, is estimating revenue. And key questions here are, first of all, how much you're currently spending on prevention case management and prevention services and from what sources. So typically this would be your contracted services under 4B, state-funded services within child welfare. Those are the typical sources of support, potentially community-based child abuse prevention. And then where agencies are looking beyond kind of their child welfare spending, where you tend to see the most resources devoted to the types of programs that can be part of this plan are through the maternal, infant, and early childhood home visiting program. So that's within public health, those dollars that are funding evidence-based home visiting models, as well as Medicaid for more clinical models. So getting a handle on what are we already funding at what capacity, particularly as a starting point from the child welfare agency themselves. And then what will the maintenance of effort requirement be? And I'll talk more about what the federal requirements are related to that on the next slide. Are any of the program models that you're implementing eligible for Medicaid reimbursement? And if so, what proportion of your candidates do you anticipate will be eligible for Medicaid? Also, is Medicaid fully funding the model? So is it funding maybe a set number of clinical sessions, but not some of the support services in the model, or is it fully funding that model? And then what's the level of evidence of the programs that you would like to implement in your plan, and are any of them well supported, since that has some implications for revenue and for your fiscal analysis. So the requirements in the law that help you to answer these questions, a first important thing to understand about the revenue side is that historically in 4E foster care, there's an income requirement. So when families enter the system, they are only eligible for 4E funding. The state can draw down 4E funding for them if they meet multiple requirements, but one of those is an income requirement. For prevention services, for 4E funding for prevention services, there is no income eligibility requirement, so we would expect that the federal share of spending within prevention services would be much higher than in foster care, in 4E foster care. And then the legislation set the federal match rates for fiscal year 20 to 26 at 50%. So 50% match on those eligible prevention services to eligible families through fiscal year 26, and then beginning in fiscal year 27, that would be based on the FMAP, the medical assistance percentage. So for some states, that will mean the federal share will increase in fiscal year 2027. In others, it will stay largely the same. I mentioned the 50% spending on well-supported programs, which is important because it creates essentially a cap in terms of how much 4E revenue you can draw down if 50% of your state spending has to be on well-supported programs. And then for maintenance of effort, the law says that it has to be the same level of state foster care prevention expenditures as fiscal year 14, and state foster care expenditures, prevention expenditures is defined as including Title 4B, TANF, SSBG, and state or local. The guidance on maintenance of effort made clear that prevention expenditures only include spending on models that are approved and in the clearinghouse at the time that your state submits their prevention plan, and on candidates for care. So it's a fairly narrow definition of maintenance of effort. And then finally, an important thing to understand in terms of the law and the guidance is that 4E is the payer of last resort, meaning that, and where this is particularly coming up for states, is if a service is Medicaid eligible, that Medicaid would pay first. And so that's a consideration for many of these clinical models that are part of the clearinghouse. A couple of additional provisions around administrative. So administrative services and training are at a 50% federal match. And the administrative services piece, similarly to under 4E foster care, includes more of the agency program planning, coordination, data, as well as child-specific services, meaning case management. And then training can also be claimed for prevention services, just as it can be under 4E foster care. So considerations in terms of estimating revenue. First, because the clearinghouse is reviewing and adding programs on a rolling basis, and more programs will be in there over time, we would expect, I think there's a greater chance of having higher levels of MOE for states that submit their plans later, just because there'll be more programs on the clearinghouse, so more likelihood that you would have maintenance of effort. And then the 50% of state spending on the well-supported is an important consideration as you're doing your fiscal analysis, because you really have to consider if you have multiple models, if the majority of your spending is not on well-supported, then that will mean you won't be able to draw down 4E for those. You would have to have at least 50% on the well-supported, unless, again, that's changed through legislation federally. And then another consideration for revenue is before Family First, states could claim 4E foster care dollars for case management for candidates for foster care. So for families where children were still being served in the home, but they were at imminent risk of entering care, they couldn't claim 4E for prevention services, but they could for case management, and many states do that. Because under prevention services claiming there's no income eligibility, you would expect that if you're transitioning that, if you submit a 4E prevention plan and submit that case management claiming under your 4E prevention plan, that you would have much higher federal match rates and revenue coming in than you have historically. One important thing to note in relation to that is that the guidance clarified that case management claiming for prevention services can only be claimed during the time frame that families are receiving an evidence-based model, so that you would potentially have to then transition to 4E foster care case management claiming once they're not receiving that model anymore, if they're still part of your prevention caseload. And then, again, for states who have an FMAP greater than 50%, the federal share of spending for prevention services would increase in fiscal year 2027. So there'd actually be declining state cost over time. So the final element that I'll talk about in terms of the fiscal analysis is estimating savings. And one thing to be clear on here is when we're talking about savings, we're talking about immediate savings, so or at least in the shorter term. So if services mean that a child is not entering foster care, what is the saving in terms of not having the costs of foster care and administrative? So it isn't kind of a cost benefit that's estimating out savings over the lifetime of that person. It's just the immediate savings of not entering care. And important questions here are how many children and youth will avoid entry into foster care as a result of prevention services? So what's your estimate of the proportion who would receive prevention services, who would complete them successfully, and if they completed them, then would not, as a result, would not enter foster care? And then, of course, what are your existing costs of foster care, so you can turn those numbers into dollar amounts of savings. So in terms of placement costs, case management costs, court and legal costs, and then also thinking about what proportion of those savings would be state, local, or federal or other funds that you're using to support your services. So the relevant provisions here are more around reporting, so they're not guiding that you have to do this kind of analysis for a savings estimate, but the legislation is really built on an expectation of savings, and that's reflected in the requirements of what states who opt in and submit a prevention plan will have to be reporting to the feds. So they're asking for individual level data on services provided, duration, and placement status, and then an annual update on services and expenditures, including the % of those receiving services who don't enter care and costs. So I think at this starting point, as we're working with states on thinking about projecting savings, there's really not a lot of great data to go on. In a few years, as this is implemented and states begin reporting this data nationally, we'll have much better information on this point. But if we go to the next slide, so around the considerations, I think the big issue here is that there's not great data, but you want to identify the data that you have and then make the most reasonable, and I would say conservative estimates that you can, given that there isn't great data to go on. So first, I think keeping in mind that your savings projection should be based on decreases in the number of families that enter foster care sort of beyond your existing prevention services. So if you're opting into Family First, and as a result you're scaling up certain programs or you're adding in new evidence-based programs, what difference do you think those particular changes in your service array are going to make in terms of savings in children and youth not entering foster care? And then I think the data that's probably most available and useful for the savings piece is that the models that are being included in plans are well-researched models with lots of evaluation data on them. So getting information from those evaluations or from program developers on how many families complete successfully and then what outcomes are seen as a result of that, and then making a reasonable estimate of what does that mean. I think you can't assume that every family that completes successfully doesn't go into foster care, but what would that translate into in terms of reduced entries? And then one question that's come up as we've been working on this is because you also have requirements within Family First that may, in some states, really change the placement array pretty dramatically in terms of reductions in congregate care. Should we be using existing costs to project savings? And I think my answer would be in the short term, until we know how much that placement array will change as a result of Family First, we'll use historical information. So we'll use this to look at the costs to project savings. We'll be looking at how many children who are entering care go into which types of placements and what the costs of those placements are. So that gives a very quick overview of some of the considerations around fiscal analysis. Again, we'll point you to some handouts that will provide you some more detail, but I want to now hand it over to Nebraska, who we've been working with. So Nebraska is an early mover in bringing together stakeholders and developing their 4E prevention plan, which they've already submitted. And we've been piloting the fiscal analysis with them with a focus on helping them understand the costs of the program models in their plan. So we're in the process of developing pretty detailed budgets for those plans to help inform their statewide rates for the particular program models, and then understanding existing revenue that's in place for prevention services and projecting out what the 4E drawdown will be for the prevention program models, and then the cost savings piece that I just talked about. So I am going to turn it over to you. See my contact information here. If anybody is working on planning in your state and wants a little more information, feel free to reach out to me. And I'm going to turn it over to Allison Gedkin with the Nebraska Family and Children Foundation to talk a little bit about the work in Nebraska.
Hello, everyone. I'm Allison Gedkin with Nebraska Children and Family Foundation, and we'll be co-presenting today with Jamie Kramer from the Division of Children and Family Services. We are very excited to share our preparation and planning experience for the implementation of Family First here in Nebraska. Before we get too far, we thought it would be important to share with you all some of the landscape of Nebraska, which you can see is very urban. The Division of Children and Family Services is one of 5 divisions within the Nebraska Department of Health and Human Services, and it is referred to as CFS. Within CFS, there are various programs which include child welfare, adult protective services, economic assistance program, and the youth rehabilitation treatment center. It is a state-administered and state-run system which includes 5 service areas across the state. As you can see by the data on the slide, the total population of Nebraska is significantly less than many major U.S. cities and metropolitan areas, with a total population of approximately 2 million across the whole state. So we are small in population and experience quite unique rural challenges with great distance between towns. And many of our big towns are still relatively small towns with limited resources, services, and programs. Nebraska Children and Families Foundation, known as Nebraska Children, is a statewide nonprofit organization that focuses on improving community conditions for children, youth, and families in an effort to build strong, thriving children, youth, and families. I'm going to share with you how our work has set the stage for Nebraska to be an early implementer of Family First. Nebraska Children works with communities throughout the state to build a community-owned prevention system. This slide illustrates the 12 community collaboratives which span across 64 out of the 93 communities and counties in Nebraska. These collaborations implement and support the community well-being model to prevent child maltreatment and promote well-being. This is done by building promotive and protective factors within the community context, across the community prevention system, and through strengthening families, parents, and child interactions. So the community well-being model includes a backbone staff, steering committee, work groups, implementation of various strategies, partnerships. It's really about capacity building. There's a lifespan focus from 0 to 26, and is really supported through multi-sector partners. This model operates within the collective impact approach, so there's a lot of focus on common agenda, shared measurement, mutually reinforcing activities, and the other collective impact core components. And there are shared outcomes and focus on increasing protective factors across all community work. So Nebraska has been focused on prevention for several years, as each of these collaboratives are at a different stage from planning to implementing to sustaining. And we've been nationally recognized for our prevention infrastructure, as noted in an ACS model, which highlighted the Bring Up Nebraska prevention system. So through the Bring Up Nebraska initiative, national, state, and community partners bring resources and solutions together to address and support community prevention efforts through the community well-being model. So in addition to what we've been doing here at Nebraska Children, DHHS was awarded the Title IV waiver demonstration project in 2013 and took that opportunity to create an alternative response path to accepted intakes at the Child Abuse and Neglect Hotline. Additionally, DHHS implemented the Bridge to Independence program, which is Nebraska's extension of foster care through age 21. DHHS intentionally connected these programs to the community-based prevention work to enhance a multi-generational approach and maximize funding opportunities. So now I'm going to turn this over to Jamie Kramer, who is the administrator with the Nebraska Department of Health and Human Services in the Division of Children and Family Services.
Thank you, Allison, and good afternoon, everyone. As you can see by this slide, the Division of Children and Family Services, otherwise known as CFS, really began the early planning about 4 months after the federal legislation was passed. So in June of 2018, we held a Family First kickoff. The purpose of the kickoff was to educate our stakeholders internally and externally on the 8 provisions outlined in the Family First Legislation Act, and to also share the big picture vision of how we as CFS plan to roll out the various provisions. The administrator lead for each of the 8 provisions did explain the purpose for the opt-in provisions and indicated if we were going to opt into the provision and specified if this provision would have a work group to lead that work. From this kickoff meeting, we established 8 work groups that were formed and really lead the work currently that is required for the core leading provisions. If you are interested in knowing more about that information, you can certainly visit our link in the 4th bullet outlined below. The biggest service or the biggest provision within the federal legislation was the Prevention Services and Program Plan. Our team dove into drafting the Prevention Services and Program Plan, but the first step was to review various data points to help describe the children, youth, and families, and to understand what impacts removal and is there or what could have prevented the removal. This led us to do a comprehensive statewide service array scan to identify the needed services within our state and any gaps within our state in which services needed to be established. This scan was then also used to identify and recommend services that could possibly fall within the Family First provision. Another work group established was the Kinship Navigator Program, and this was focused on researching evidence-supported navigator programs, reviewing available data, recommending key components the Kinship Navigator Program could encompass, discuss and recommend an implementation plan, etc. Overall, having these work groups and our website created helped the department to provide transparent communication to both internal and external stakeholders and to keep other folks engaged about where we were in implementing FFPSA. As discussed before, there was some early data analysis that we pulled. During Nebraska's 2019 fiscal year, as you can see, a little over 6,300 youth were known to be in child welfare cases that would have qualified for a foster care prevention plan. Between 2017 and 2019, our division was able to safely reduce the number of children placed in out-of-home care by 15%. What we found was that the majority of children that do enter our foster care system is due to neglect. Parental substance abuse is a contributing factor for about 50% or more of children who enter out-of-home care in Nebraska. What we found with the age of the child or youth at time of removal was that in 2017, for children between the ages of 0 and 5 who entered foster care, 47% of those children were age 1 or younger. For children between the ages of 0 and 5 who had a parent formerly in foster care, that was at 40% as of July 2018. Their parent was found to have been in an ongoing service case with us at some time in the past. Beyond the reduction of children in out-of-home care, we have also increased the use of our relative and kinship resource homes by 12% since 2014, and we have also reduced our congregate care by 3%. The decisions or further discussions that resulted from the analysis included a special study which was conducted by our Foster Care Review Office regarding the re-entry of youth after adoption or guardianship dissolution. As of the end of 2018, 4.3% of our child welfare population were previously placed in permanent homes through adoption and guardianship, and many of these homes are now no longer a permanent option for those youth. Like I said earlier, the biggest provision for Nebraska or for FFPSA is the 5-year prevention plan. Program instruction was provided during the summer, which relayed the services that were identified to be well supported, promising, or not rated by the Title IV Federal Clearinghouse. What we were able to garner from that was this list of services that we knew we already had within the state that would be found as rated with the exception of family-centered treatment. To be able to identify providers within the state to provide such services, we decided to utilize the request for qualification or RFQ process to help identify these services and providers in our state. What we received were a total of 18 providers across the state that responded to our initial RFQ process, of which we offered contracts and or subawards to 15 of those providers. We do anticipate that FFPSA will be cost neutral and that the new services provided under FFPSA will displace current prevention and alternative response expenditures. Under the 4E waiver that Allison spoke about earlier, which ended on September 30th of 2019, we were able to claim federal 4E dollars for alternative response services. FFPSA now will displace many of those expenditures they did displace many of those expenditures as of October 1st this year when we implemented FFPSA. And those expenditures will now fall under traditional claiming or maybe 4E eligible. New staff or additional administrative expenses are also not anticipated to be impacted, as we will utilize the current staffing levels we have now. So in the short term, we do anticipate that services will be cost neutral, but in the long term, we do anticipate that as the population coming into child welfare goes down, so will our spending. It should be noted that each division within DHHS has also received funds to further the mission of the department. CFS, fortunately, was able to receive a portion of that money and will use that to help our providers to expand capacity of services already within the state that meet the definition of well-supported, supported, or promising by assisting with their startup costs and or training of their staff. Through this, we have found a collaboration with Mainspring, and we partnered with them starting in September of 2019, and we began a data exchange through a memorandum of understanding with Mainspring, providing technical assistance to us to aid in the construction of the Family First Act fiscal analysis. The main segments of the estimate include determining what the cost estimates will be for implementing evidence-based prevention programs under the Family First Act options, examining any potential offsetting revenues such as outside funding streams, MOE requirements, and additional 4Es to support administrative costs, and lastly, cost savings projections based on population decreases. Overall, in working with Mainspring, our goal is to gain a more comprehensive understanding of the fiscal impact along with a cost-benefit analysis as it relates to implementing FFPSA in Nebraska. And with that, I will turn it back to Allison.
So we provided a quick overview of the steps Nebraska has taken to implement Family First and what really set the stage for that. But we also thought it would be important to share a few lessons learned. So here are our 3 lessons learned. Number 1, collaboration. So collaboration across sectors and within communities takes a lot of time, patience, and energy. And as we focus on community-based prevention efforts, collaborating at all levels can be difficult, and it can feel sometimes like we are moving rather slowly. In addition to collaborating across sectors and communities, we have been diligent to collaborate with youth and families throughout the development of our community-based prevention efforts. While we have a long way to go for a truly family-driven system, we continue to keep this on the forefront and work to achieve this goal. Communication. With all of our work, continuous communication is imperative, especially when we are focused on collaborating with all the different entities and stakeholders, all the different levels from community to statewide partners to practitioners. We must continually communicate what we've learned, the plan, and the next steps. And lastly, flexibility. I'm a big proponent of the notion that we get smarter every day, which has actually been rather critical in the development and the implementation of Family First, because we truly get smarter every single day as new guidance is issued or new legislation is proposed, and all of those new developments really can change the trajectory of the work that either we plan to do or that we've started to do. So really being flexible has been a critical component, and then continuing the conversation and the communication about what we have learned so that our partners can be flexible as well. So again, thank you for the opportunity to share our experience in the development and implementation of Family First here in Nebraska.
Well, thank you, Allison, and Jamie. Sorry, there's some echo. And Margaret, for your interesting and informative presentation. I think you've given us a lot to think about when it comes to costs, certainly, associated with selecting and using programs, but we've also learned a lot from Allison and Jamie's partnership in negotiating this shifting landscape that the new federal legislation has created. So now it's time for questions from our listeners, and we have several, so I'll try to get to as many as I can. The first one is probably for you, Margaret. Since Medicaid will pay for certain EBPs already identified, evidence-based programs, does the toolkit address Medicaid funding, and if so, how does this impact the evidence-based program percentage requirements?
Yes, okay. First, it does address Medicaid funding, and I think the way we address that through the toolkit is that there really has to be an analysis of the particular program models that a state chooses, where they're Medicaid eligible for, what those costs will be, what Medicaid is covering, and what the costs of the 4E funded models will be in terms of ones where it's not Medicaid funded, in order to then look at the balance of how much is being spent on the models that aren't Medicaid funded versus those that are and that are well supported. So it will depend state to state. And I think I probably should have said up front, of course, because this is new policy and guidance continues to come out and will continue to come out, there is plenty that's not totally clear from the federal level yet. But until there's greater clarification, I'm operating on the assumption that states, that 50% well-supported requirement would have to be for the state spending within the 4E, that's drawing down 4E. There's been a question about whether state spending for Medicaid-funded programs would also count, and I think that's just not clear yet where the feds are going to land on that. But for our analysis for now, until we know, we're kind of taking the more conservative path and considering that it would be 50% spending on well-supported that have the 4E drawdown.
Thanks. So the next one is for our Nebraska panelists. Were the programs in your analysis already in place through your providers, or are your providers transitioning to the well-supported programs?
These are services that were already in place. As we continue down with researching services and services continue to be rated by the Federal Clearinghouse, our intention is to create or establish additional services that we may not already have in our state, and work with providers in identifying what those services are, and also identifying what the needs are in different geographical areas within our state to help better suit the families that we serve.
There's another one sort of related. Can you talk a bit more about how you determine candidacy for Nebraska?
Sure. So the way that we determined candidacy was to take a look at what sort of tools our CFS workers are already utilizing. What we use is we use a structured decision-making evidence-informed tool during our initial investigation phase. What that does is it provides us an ability to go out and meet with the family after an intake has been accepted for abuse or neglect, and we can assess for safety and risk. From there, what we determined was if there was an identified need for us to continue to work with this family, they could possibly qualify as a candidate for being at imminent risk of entering the foster care system, as long as that foster care prevention plan then was written out with the family and they were provided one of our evidence-based services that we provide in the state. We do have a goal in the long term of working more in the primary prevention realm, but right now it's really going to be that secondary prevention where they come into our system, but meeting them more at the front door versus layering on the services 30, 60, 90 days later after the case opens.
Thank you. So, Margaret, this is for you. Is there any occasion where federal funds might have to be given back, say where a state doesn't make the 50% well-supported match? And thought they might?
Yeah, I mean, I think it's always possible through an audit that states would have to give back funds if they weren't meeting the full requirements of the law, or it might be that they just wouldn't draw them down in the first place if they weren't meeting that 50% well-supported. So, yeah, I certainly think it's a possibility. And, again, there's a lot that's unclear in terms of how the Children's Bureau will be kind of monitoring and enforcing and, making sure that that 50% requirement is met as it rolls out. So it's hard to say until more of those processes are laid out and begin to be put in place.
This is also for you. Is it your understanding, Margaret, that an independent review of programs is required prior to including non-EBPs in a state's plan, or can the independent review be conducted in concert with using that program or service?
So under the transitional payments option, it would need to be that independent review has to be submitted prior to, so it's part of your submission of your 4E prevention plan. And then if it gets approved, and you can be claiming for those, so as the clearinghouse is going through the process of reviewing your independent review and making a decision about whether it meets the standard, there can be claiming in that interim process on that program. If it were then subsequently decided that it didn't meet the standard, then claiming would just have to end in that next quarter after that determination was made. You wouldn't have to give those dollars back. And then if it did meet the standard, it would be part of the clearinghouse and you could just carry on. But the independent review does have to be done and submitted with your 4E plan if you're putting that program on your plan for 4E reimbursement.
Do you know, Margaret, if states are collaborating at all on which transitional EBPs they're working on when they submit their evidence for approval so that they're not duplicating their efforts?
I have heard of that, but I don't have specifics on sort of which particular program models or which states. But I think there's certainly some of that conversation going on in the field. And on a related note, I forgot to mention that one of the handouts that we have linked at the end of the slides is a handout that just has a listing of some of the states that have submitted plans, what evidence-based models they've included in their plans, and it indicates which of those are well supported, which of those are in the clearinghouse now, which are under review, and which are not in the clearinghouse, just because folks may be wondering what's being submitted for transitional payments.
Thank you. I have one more Medicaid question for you, and it's specific to tribal claims. The question is that there is a state Medicaid SPA that allows for 100% FMAP from federal dollars for tribal clinics. Will this be 100% federal FMAP for the American Indian tribes? Will that also apply for the Family First funding, or is that still separate?
I'm not certain. I would say if that's the FMAP you're using for your 4E foster care, that would be, you could assume that the FMAP you're using for 4E foster care would be the same FMAP that you'd be using for 4E prevention.
Yeah, I think that's right. So I have one more, maybe two, and this one is for any of the three of you. There are always concerns with the time invested in reporting requirements. Do you have any information on the considerations of time being decreased in meeting those reporting requirements?
Well, a resource consideration would be meeting those requirements. There could be administrative claiming under 4E to meet those requirements, so there could be some federal support for that. But in terms of consideration about maybe changing those requirements because they're too burdensome, if that's the question, I have not heard of that. But states can claim 4E administrative for the work that they'll have to do around data and evaluation.
Jamie or Allison, do you want to weigh in on this one?
That's something that I hadn't considered or I don't know much about at this time, so that's something that I would have to look into more.
Okay. And then one more, and that is do you know the infrastructure components that you talked about, you specifically, Margaret, are they billable to 4E?
Yes, most are. Most could either come under administrative claiming. So similar to 4A foster care, you can make administrative claims under 4A prevention. And most of what I outlined would fall under that administrative claiming, or then there's also 4A training claiming, again, similar to foster care, but that can be done under the prevention plan.
That's great. Thank you all three of you for your responses. As always, we include additional informational resources to supplement this presentation. Listed on this slide are the materials that offer federal guidance on program and payment requirements. Slide 39 has Margaret's handouts, which she's referred to throughout the presentation, which she mentioned today. On the next slides, you'll see other resources to inform things like program selection, implementation, payment criteria for proven programs. Soon, you will receive via email a short survey designed to get your input on existing research evidence gaps in child welfare. This is a joint project with Annie Casey, William T. Grant, and Casey Family Programs. The survey will be sent by the Urban Institute, so you can look for that. We hope from this survey not just to get an understanding of where the gaps are in research, but also to get ideas from your responses that will help us create the 2020 series of Leading with Evidence webinars that we plan to present next year. And so that brings us to the end of today's webinar. We hope you've learned something about estimating costs and selecting and implementing programs, and that you can also take away some of the lessons learned from the experiences of our colleagues in Nebraska. And most importantly, you can use them in developing your own practice models. Thank you so much for your interest and your attention.